The UK has become the first country in the world to approve the Pfizer vaccine for coronavirus. Patients will begin receiving the jab in hospitals across the UK next week. Tonight, we'll look at who will get it first and how the NHS is preparing for the biggest vaccination programme in its history. The first doses of the coronavirus vaccine could arrive in Britain as early as tomorrow, after the UK's medicines regulator became the first in the world to approve the jab developed by Phizer and BioNTech. The vaccine, which offers up to 95% protection, has been developed at unprecedented speed, taking only 10 months to complete a process that would normally span 10 years. Speaking at a news conference at Downing Street in the past hour, Boris Johnson said delivering the vaccine would be a vast logistical challenge, but it was now a case of when, not if, life would return to normal in the UK.
We've been waiting and hoping for the day when the searchlights of science would pick out our invisible enemy and give us the power to stop that enemy from making us ill. And the scientists have done it.
A mass immunisation programme will begin next week. The Chief Executive of NHS England, Sir Simon Stevens, said the first jabs would be given to care home staff and the over 80s at around 50 hospitals around the UK.
Typically, they may be people who were already down to come into hospital next week for an outpatient appointment. So if you're going to be one of those people next week or in the weeks that follow, the hospital will get in touch with you. You don't need to do anything about it yourself. That will then be followed in the subsequent weeks with GP practices coming together in each area to operate local vaccination centres.
The Deputy Chief Medical Officer for England, Professor Jonathan Van Tam, described how he felt when the regulator gave the vaccine its final approval.
I don't mind telling you, I'm not saying it for effect, the office will tell you it's true, that I was quite emotional this morning. And what a momentous journey and international effort it has been, and then involvement of our own UK MHRA to bring home the goods.
The UK has ordered enough doses of the Phizer BioNTech jab to vaccinate a total of 20 million people, with the first batches already on their way from Belgium. Care home residents are at the very top of the government's priority list, but initially the vaccine will be distributed only within hospitals. Pregnant women have been advised not to be vaccinated when the programme is rolled out more widely next year. Our first report this evening is from our science correspondent, Palab Ghosh.
With approval granted by the independent regulator, vaccines can now begin to be shipped to the UK. 800,000 doses are expected in the coming weeks, with the rest of the 40 million that's been pre-ordered to follow next year. They need to be transported at -70 degrees Celsius. BioNTech's Chief Business Officer, Sean Marrett, said the vaccine would be transported to the UK in what he described as thermo boxes.
We're packing them now as we speak and getting ready for shipping. So this is in Belgium that we're doing it, at our colleagues at Phizer, at their facility. These will be shipped by either road or plane, whatever's quicker. What we can definitely say is it will arrive, first consignment, in the next few days. And that could be as early as tomorrow, or it may be a few days later.
The government's independent vaccine advisory body confirmed today that care home residents and their carers would be top of the list to receive the jab. But because the doses have to be kept at ultra-low temperatures, the first batches will be sent to large hospitals which have the facilities to store them. And to begin with, frontline healthcare staff will receive the first jabs. Care home residents are also expected to be vaccinated in the first phase. The next phase will be for those over the age of 80 who are not in care homes and other healthcare staff before it's rolled out more widely. Some have questioned the speed of the decision to approve the vaccine in the UK. The European Medicines Regulator said its own assessment required more checks and wouldn't be ready until the end of the year. But the head of the UK regulator, Dr. June Rain, said that the public should have absolute confidence in the vaccine.
The safety of the public will always come first. This recommendation has only been given following the most rigorous scientific assessment of every piece of data, so that it meets the required strict standards of safety, of effectiveness and of quality.
Professor Ralph René Reinhardt of Pfizer said he had nothing but admiration for the way the British regulator had carried out its duties.
The world is looking at the UK at the moment and other countries. They look, how could the UK approve this? What is their experience? And there will be an exchange between those countries.
2 injections, 21 days apart, are required to get the full benefit, which takes effect a week or so after the second jab. It's hoped that the Oxford and Moderna vaccines, which are undergoing the approvals process, will be available soon. GP surgeries will be open from 8 in the morning to 8 at night to dispense the jabs. And thousands of volunteers are being trained to work in mass vaccination sites, which include car parks and gymnasiums across the UK. But the government's chief scientific advisor, Sir Patrick Vallance, warned that it'll take some time before vaccination is widespread, and for now advised people to stick with the current measures to keep the virus at bay.
The mass immunisation programme will be the biggest and most challenging in the history of the NHS. These people in London and Buckinghamshire gave their reaction to the news that the British public will be the first in the world to be offered the jab.
I will take the vaccine. It will give me, hopefully, freedom again to go out and about, having virtually been housebound for 9 months or whatever.
I can understand people's concerns about it being rushed through, but that's what the trials are there for.
I mean, there's a collaborative worldwide effort in producing all these vaccines, so somebody has to be first.
Obviously, lots of drugs come out quite quickly, but we usually have quite a few years to test them before we give them to the main public, so I'm not sure about it.
British virologists have hailed today's announcement as an extraordinary moment for science. Our medical editor Fergus Walsh explains how the regulators were able to prove the vaccine was safe at breakneck speed.
This is a huge moment for science and for mankind because it means there's now a clear route out of this pandemic thanks to immunisation. The medicines regulator, the MHRA, is highly respected and independent. It's been conducting a rolling review of the Phizer BioNTech vaccine for months, which helps explain why it was able to move so fast. Other regulators in Europe and the US are expected to make their decisions later this month on whether to follow suit and grant emergency authorization. It usually takes a decade or more to develop a vaccine, but science has moved at lightning speed, running stages of the development in parallel rather than one after the other. But the regulators and leading scientists are adamant that at no point have any shortcuts been taken with safety. All medicines have side effects, but there were no serious adverse events in the trial, involving around 43,000 adults aged 18 to 85, half of whom got 2 doses of the jab 3 weeks apart. Some protection begins after the first dose, but the full 95% effectiveness kicks in a week after the second jab. What we don't know yet is how long that protection lasts. It may be that a further booster dose is required in the future. We also don't know if the vaccine stops people passing on the virus. That will be important for controlling the outbreak here. Vaccines won't have an impact for months. We face a tough winter. But a brighter future, free of social distancing and face masks, does now look possible. And that is something worth celebrating.
The latest daily figures show a further 648 people have died in the UK within 28 days of testing positive. The total number of deaths now stands at 59,699. 16,170 new infections have been recorded. Today's announcement has eased the pressure on Boris Johnson after last night's Commons vote on the new COVID restrictions in England saw him suffer the biggest rebellion of his time in office. Our deputy political editor Vicky Young considers what this moment means for the government.
A day to remember, a year to forget. That's how Matt Hancock summed up the situation after today's vaccine news. After 10 months during which many mistakes have been made, ministers are understandably relishing this positive development and the fact that the UK is the first to approve the Pfizer vaccine. At last, an international comparison they can be proud of. Both the Health Secretary and the Prime Minister described themselves as natural optimists. Both are trying to balance their joy with a dose of reality. Boris Johnson is urging us not to get our hopes up too soon, as he described the immense logistical challenges ahead. And this government has been accused many times before of over-promising and under-delivering. It means that in January, Mr Johnson is likely to return to the Commons, asking once again for MPs to extend COVID restrictions, probably for several more weeks. Last night, 55 of his own backbenchers refused to back the regional tier system, the largest rebellion he's faced. But in the new year, the Prime Minister will be able to say with more confidence that the end is in sight, and that could calm his anxious party.